can't have the session without introducing you all to my baby massage doll. So this is Amelia, everybody, and she's been on my baby massage journey for about 10 years. So I couldn't resist introducing you to her. So this is Amelia, everybody. Just going to put her down.
Fantastic.
So, okay. So just a quick kind of history into infant massage. So in many cultures, infant massage has been passed down from generation to generation. And in many cultures, you may find the older lady massaging the babies in the family. And this is quite normal for a lot of families and cultures. Infant massage was first formally introduced around 1979 in America by a lady called Vimla McCall. Now she served in an orphanage in India, and she became fascinated about infant massage, which is why she developed this program. So the program that she developed is called IAIM, which stands for International Association of Infant Massage. Now there are many different training programs on baby massage, but the one that I'm kind of familiar with is her program. And the one that we deliver in our service is through the IAMS. So a lot of the strokes that you find do come from India and Sweden as well. So she's combined the two together and developed this training program. Okay, so what is infant massage? So infant massage is when a parent or primary caregiver provides loving strokes or holds their baby. We use a non-fragrance vegetable oil, and strokes are given on each area of the body following a sequence of strokes. In regards to the oils, we do recommend vegetable oil, but if babies have got sensitive skin or parents are used to using something else on their skin, we just go with whatever they're happy with. Infant massage is baby-led, so we never wake babies up or massage crying babies. So when they come to groups, we encourage parents to meet babies' needs and kind of, if they need to walk around the room, we let them do that, or just to kind of make babies feel comfortable. We also have spare massage dolls, so if babies are sleeping, they can practice on the dolls, or at the moment we are doing these groups online. So if babies are sleeping, we suggest if they've got a teddy or doll, they can practice the strokes on that. Benefits of infant massage. So infant massage has benefits for both parent and babies. There's a big long list of benefits, but I've just picked out a few. So some parents say their baby sleeps for longer and deeper after a massage. Strengthen parent-baby communication, develop muscle tone and coordination, enhances understanding of baby's development and reading cues. Quality time with baby. So a lot of parents have said that it's nice to spend one-to-one time with their baby during massage, because especially if they've got older children, it's a nice time, I think, for parents to spend with their baby. Some parents have also reported that it relieves wind and constipation, and it's a chance for parents to get to know their baby, so what strokes they like and what strokes they don't like. So babies feel respected. So I'll put that one in there because each part of the session is we ask permission. So we really introduce the fact about asking permission before parents take baby's clothes off and before they start the massage, just to get babies aware about asking permission before that is done, and it's a way of parents communicating with their baby. Feeling secure and providing nurturing touch, and group sessions also enable parents to meet one another and to kind of share information and just get their thoughts about. Obviously during COVID it's been quite difficult, parents aren't able to meet, but having some sessions online just enables them to kind of connect with one another and just share some information and tips really of what they've found, which has been helpful. So what the sessions look like. So we have our introductions and icebreakers. So each week we asked we asked babies something babies new that they've done this week, or something that they did to make them smile. Relaxation is also part of the session. So each week we do relaxation techniques, whether it's breathing, whether it's just moving our shoulders up and down. And it's quite, this is probably might be the only time that parents do get that time to relax. So, you know, we make a time to do that in each session. During each lesson, we learn different strokes, and I obviously demonstrate them on my massage doll. Each stroke has also a different name, so parents can identify the stroke to a name. So week 1, we do the legs. Week 2, we do the stomach. Week 3, we do the chest and arms. Week 4, we do face and back, and week 5 we do some gentle movements where we just move in baby's arms and move baby's and baby's legs and just sing some songs with those movements. Massage can be quite stimulating for babies, so we don't teach all the strokes all at once, and we encourage parents to practice some of the strokes at home before the next session. So the sessions are just not about learning massage, it's about facilitating certain discussions as well. So some of the discussions we have in the group are around why babies cry and any thoughts and feelings parents have towards, you know, when their babies cry. We have discussions around spoiling babies and what that kind of means to them, balancing stress and relaxation, and how parents can engage the whole family. So one of the things we kind of do is kind of get dads involved as well. So we just mentioned in our groups about teaching dads the massage as well, to get them involved in one-to-one time with baby, and also involving the older siblings as well. So sometimes mums find it difficult massaging babies because they've got the older child, so we kind of make suggestions around having their older child next to them while they massage their doll or teddy or even dinosaur, to bring the whole family together. Some of the theory we cover in the group are different behavioural states and the best time for massage, so just getting parents to kind of really understand what's going on for their baby at different times. Some environmental factors to consider when doing the massage, so things like making sure the room's warm enough, especially during the winter, because when we're undressing babies we don't want them to be cold. We talk about the differences between colic and gas, and some of the benefits baby massage has. We also talk about how parents can adapt some of the strokes for when their baby grows older. So a lot of the time we find babies are rolling at 4 months, so we kind of adapt some of the strokes. So we say, you know, we ask parents to kind of sit baby up, so then they can massage, say, the legs, for example, or if they're happy to be on the tummy, then we can massage the back. We also provide suggestions about if they wanted to carry massage on to when their baby grows. So, for example, toddlers, we get them to kind of do like weather patterns on their backs, or get parents to kind of do different shapes on their backs, which toddlers love. We also ask parents to bring any topics they would like to discuss, because I think it's quite important to kind of talk about things that parents want to talk about. So that's one of the things that we kind of open it up to the group to talk about anything that they want that's on their mind. A lot of the time we do get sleep, so I just add it in wherever I can in the session. Sessions last about an hour for 5 weeks, and can be done in groups or one-to-one in parents' homes. At the moment, the groups are run online, but we have planned to do a face-to-face one in July, fingers crossed. So that'll be quite exciting. And the group's suitable for babies for birth up until they're pre-crawling. Once they start crawling, it gets a bit difficult to do the massage. And that's it. Short and sweet.
Great, thanks. That was really good question, Amit.
What shall I do? What should I do? Just trying to think which one will be the easiest.
Just the very basic.
Shall I show you the back? Because the back's always nice and easy, straightforward.
Yeah, thanks.
So I shall get my massage doll and I will ask her permission if I want to take your clothes off. So Amelia, I'm going to take your clothes off now. I'll have to position her. You can see her and not me. So this is another tricky thing as well. When you do it online, a lot of the time they can't see you because you're trying to they need to see what you're doing. So
she's got a beautiful dress on.
Thank you. This is actually a dress from CNA, which I think my mum bought for somebody, and obviously they didn't end up wearing it. So it's a very old dress. Okay. So, okay, so the back. So how we would position baby. Can you all see Amelia okay? So if they're happy to be on their tummy, we would kind of just say that you could just put them on the tummy. If they're not that happy, you could put your legs out and cross your legs over and put baby on your legs like that. But Amelia is quite happy to be on her tummy. She doesn't complain. So with the back, what we do first is we take the oil, rub it together. And normally what we'd say is it would say massage time now. So we show our hands to baby, but Amelia's already on the front. So we'd say it's massage time now. And then we'll just do some resting hands on the back. And then we're just going to be doing back and forth. So we're just going to do back and forth and just making sure baby's comfortable and happy. And if they start crying or get unhappy, then we can give them a cuddle. Okay, to the back and forth, all the way up and down. And then I'm going to say swoop in part A is one hand on the bum, one hand at the top, and we're just going to swoop down all the way down to the bum. Okay. And then the second part of swooping part B is just lifting the legs up slightly and going back down again. Okay. And the next one, we've got back circles. So we're just going to be doing circles on one side of the back and on the other side. And we're just going to be mindful of the spine, so making sure that we're not massaging on the spine, so making sure that circles are from one side to the other side, one side to the other side, to the other side. And the last part of the back is the combing, so spreading your fingers out, and we're just going to be combing down the back from the top to the bottom, the top to the bottom, top to the bottom. And that's the massage done for the back.